about the 1970, I believe it was, decision to treat a drug as a drug, and given that that was before some of the new drugs, and you're saying LSD is possibly not addictive, and now you have like the methamphetamines and the crack cocaines and things like that. And so the people that would be using those drugs, and I'm thinking like you put 100 people in a room with alcohol and you might wind up statistically 10 alcoholics, and you put 100 people in with crack or meth or something, you're going to wind up with 100 crack and meth addicts. Is that true, or do you think that drug as a drug is still valid, given the fact that as an addict, or are there different, is that just a dependency versus an addict? I don't know if there's a differentiation between being chemically dependent and being addicted to it. You know what I mean? It seemed like if you've used that stuff, at least it's my understanding that if you use it even once, you become addicted to it.
Well, no, I don't think that people use something once and become addicted. People can use cocaine, which is highly addictive, or nicotine is highly addictive. People can smoke some cigarettes or use some cocaine and not become addicted. I think that different substances have different addictive potentials. So, for example, marijuana is a lower addictive potential. Okay? I think people can smoke marijuana more commonly and not necessarily become addicted to it. Nicotine, people and cocaine are highly addictive. You use it a few times, 3, 4, 8 times, I don't know how many, but it doesn't take as much to get addicted. So it really has, I think your question has more to do with certain drugs have different addictive potential, and certain people have certain addictive potential, okay? And so it's that combination, really. And that's why it's hard to sort of answer your question specifically, because it has to do with the individual's propensity towards addiction along with the substance they're using. So it's a complicated sort of picture. Other questions?
The light's on so we can see you, not because we're free.
Well, it's up to you. I mean, I can go on to my other slides, or we can stop now, whatever you all would like.
I'd like to see it. Well, just throw my hat out there.
Okay.
This is very good.
I'm going to skip this part. This is just about the different drugs we use. I don't think we need to talk about that so much. I'll talk about this a little bit. You want to kill those slides again? The lights if you want. So, young adult and college age drinking. Someone asked this. This has something to do with peer pressure. So young adults and college age, there's a myth. And the myth is that many parents and doctors believe that alcohol and drug use is a normal part of adolescence. You know, the concept is that they think that alcohol and drug usage will always happen. You know, there's nothing that we can do about it. Kids on campus will just drink, and they'll outgrow it. Okay? And those of us who work in the field, we know that early use does predict later addiction, like we talked about with the marijuana gateway drugs, and that there's been a 25% reduction in teen usage since 2001, meaning that we can make a difference. We can decrease the use significantly, and there has been a significant decrease in teenage usage. Another example of that is Ronald Reagan, when he was president in 1987, passed a law that increased nationwide the drinking age to 21. Prior to that, different states had different laws, and it was a state-regulated issue. In 87, it became nationwide 21 drinking age. And as a result of that, within just several years, there was a 60% decline in traffic accidents in that age group. And so there was obviously tremendous personal and public benefit from that. So it's not true that we can't do anything about it. Okay? There are things about it. We must educate the young adults about opiate addiction, tolerance in particular, because young adults commonly die from overdoses of opiates. We see that a lot at Ridgeview. Unprotected sex, drunk driving, all great consequences in the young adult population. There's a range of conditions all the way from use, misuse, risky use. This is part of what you were talking about, you know, how you define a problem. And there's sort of a spectrum all the way down through abuse, addiction, disability and death. College-age drinking is really, we believe college-age drinking really begins in high school. And these statistics right here show this. If you see this, there's a big difference between ninth graders that binge